Hello, everybody. This is Dr. Lorn Allison with the masterthebody.com podcast. And today I'm going to talk about the use of glandular extract in a supplement form for treating certain issues with either organs, glands, systems in general. A lot of practitioners are using glandulars to support, let's say, something like thyroid or adrenal. Many of you would be familiar with the use of thyroid medication for thyroid function, and something outside of synthroid in most cases is a pharmaceutical form of glandular. Now, in the clinic here at Master the Body, I only would use glandular extracts in very extreme situations, primarily because empirically over the years I have found that glandular extracts are generally sensitivity causing in a lot of patients. Now, I have to say that most of those people who would show sensitivity to a glandular would be people who were already highly sensitive. And of course, that's mostly what we get here in my clinic. And so a lot of people have asked about this because they've either gotten glandulars from another practitioner or they have read about it and have sought out finding a glandular somehow. The main issue that I have seen over the years is that can drive overactivity a lot of the time, or it can drive the immune system to respond in an unfavorable way. Now, I can get into why that would be with respect to maybe you're not treating the right thing, but in retrospect, really the bigger issue is that with let's say adrenals, we'll take the adrenals as an example. When you start using glandulars on the adrenals, which many people who have been ill or chronically fatigued, if they've gone to an alternative practitioner, they in many cases would have been given an adrenal glandular. And there's nothing wrong in general with that, other than if they have a very, very sensitive system, or they have even food sensitivities versus for food allergies, although food allergies would be along the same lines, they will have reactions to it. Now, that may be overreacting. In many cases, the glandulars are given in doses and potencies that are too high to begin with. But a person's immune system may have a reaction to just the consumption of the glandular. So the bigger issue there is that taking a glandular may overstimulate the system and cause a reaction that's unfavorable in the long term, and particularly if they continue to take it. And so I basically only use glandulars in extreme situations and for a very short period of time. The rest of everything we would use would be either enzyme, vitamins, minerals, and some other techniques that can be used to stimulate the adrenals. But the bigger issue there is that you may not be trying to stimulate the adrenals. That may not be the best way to go. But glandulars themselves, whether they're being taken, in pancreatic type enzyme form or any of the other animal-based enzymes or ox bile, these things can be a little harsh on the person's system who is sensitive. And like I said, most of the time in the clinic here, we get people who are very, very sensitive. Now, a lot of practitioners will probably argue with me about the use of glandulars, and I'm not saying that they cannot be used or should not be used. What I'm saying is that over time, particularly with hypersensitive patients, that their use is really not that beneficial, and in many ways will prevent them from possibly getting the long-term relief that they're looking for. So if I were to take the adrenal gland as a representation, so a patient comes in and is fatigued, let's say, something that would be attributed to adrenal function, although it may not be the adrenals, what we would do was try to make an assessment as to whether or not it was coming from the adrenals. And let's say we assumed that it was. Many, many times it is not coming from the adrenals, although in the current scenario, even in the alternative practice in functional medicine, there is an assumption when it's tested, and that gets into another topic, that, we see there's a problem with the adrenals, so let's treat. So let's say that we actually had a legitimate case of that and we were going to treat. If you went to using a glandular And they were taking it 7 days a week, and they were taking it for a few months. Many times the patient will have a boost, and then within a short period after that, they now come back in a month or 2 months. It just depends on the person, and say, wow, I was doing great, and now I'm totally exhausted again. And they might even have another issue come up. Now, aside from the arguments that I could hear a lot of people would bring up, or practitioners would bring up with this, with respect to, it's the dosing, it's the potency, it's this and so forth, is we have found that there ends up being a sensitivity, whether it's a subtle sensitivity, one that is hard to define, or outright. They could be having, anything from something along the lines of like rashes and so forth. If we were to pull the glandular out and support with enzymes or amino acids and minerals and so forth, what we've found is that we won't get that letdown that comes after a month or 2 months or 3 months. We won't get the burnout now, because what we're trying to do is support the gland or the system or the organ without overstimulating it. Now, and I'm saying overstimulate, and again, people can certainly argue against this. What I'm saying is that from a clinical standpoint, over the years, we're talking thousands of patients, that the glandulars seem to be too harsh and they seem to overstimulate. That is one thing that a tired and worn out body does generally not respond well to. Now, someone may say, well, yeah, but that's not the case I had. I went to a practitioner, I got tested, I took glandulars, and I did great, and then I was off the glandulars, and everything's fine. And that is fantastic for that person. Again, it can work, but what I'm saying is in the majority of the cases that we've seen, where in the Master of the Body clinic, where we deal with very, very hypersensitive people with many times long, chronic standing issues, that it doesn't work that way for us with the glandulars. It would be a rare opportunity for us to treat someone with a mild issue that responds to glandulars and then they're all better and everything's fine. And I know many people will argue this idea of what other things need to be done so that the person can take the glandulars. But there have been many, many instances where I have had patients who have been on glandulars who are actually having problems from the glandulars, and now they have multiple problems. But I would really say that anyone with a chronic fatigue will not do exceptionally well in the long run if they're basing a treatment on glandulars. Generally speaking, I was trying to answer the question as to why glandulars may not be the best choice for a good number of people. And I think the bigger issue is that they're very strong, and so the main issue is that they overstimulate. So we will use other options as much as possible, and we have gotten fantastic results doing that. The patients do much, much better when we use other supplements or other ways of supporting the glands, and that includes the thyroid. I just use adrenals as an example because it's gotten very popular to talk about adrenal function, even over thyroid function. It's sort of the newer, the more common thing that's read about adrenal fatigue and so forth. That is a different discussion, which I will do a different podcast for that because there is a little more to it. So I hope that helps. You can visit masterofthebody.com, subscribe to the newsletter. Certainly we are doing services and phone consults and serve people from around the United States and actually internationally. This is Dr. Allison again. Take care.